Welcome to our channel. Today, we're diving into a crucial topic, the early signs of dementia that few people know about. You see, dementia is often thought of as a disease of forgetfulness, something that happens later in life. But the truth is, the changes in the brain that lead to dementia often begin years, even decades before symptoms appear. And often, those early signs are subtle, easily brushed aside or mistaken for something else. We're going to explore 7 early signs of dementia that you might not be aware of. Early detection allows for earlier intervention, which can slow the progression of the disease and provide a better quality of life for those affected and their families. So, whether you're concerned about your own cognitive health or simply want to be more informed, stay tuned. We all forget things from time to time, right? Where we put our keys, that appointment we scheduled, a name we should remember. It's a normal part of life. But when we talk about memory loss in the context of dementia, it's a different story. It's not just about forgetting where you parked your car occasionally. It's about a persistent, noticeable decline in your ability to remember recent events. You might find yourself forgetting conversations you just had, important dates, or information you recently learned. And here's the crucial part. This type of memory loss often disrupts daily life. It goes beyond simple forgetfulness and starts to interfere with your ability to work, maintain relationships, or manage your daily activities. If you notice a consistent pattern of forgetfulness that affects your daily life, don't ignore it. It's crucial to talk to your doctor. We all have our routines, those everyday tasks that we do almost without thinking. Maybe it's making breakfast, driving to work, or following a recipe. But for someone in the early stages of dementia, these familiar tasks can become surprisingly difficult. Imagine struggling to follow the steps for making your morning coffee, a routine you've done countless times before, or getting lost driving home from a place you've been going to for years. These are signs that the brain's ability to process information and execute familiar tasks is starting to falter. The changes can be subtle at first. Someone might start needing more frequent reminders to complete tasks, or they might rely more heavily on written instructions or help from others. If you or someone you know is experiencing this, it's crucial to seek medical advice. Early diagnosis and treatment can help manage symptoms and slow down the progression of the condition. Communication is at the heart of our human experience. We connect, share ideas, and build relationships through language. But dementia can chip away at this fundamental ability, leading to a range of communication difficulties. In the early stages, these challenges might be subtle. You might notice someone struggling to find the right word during a conversation, using a general term like thing instead of a specific noun. They might pause frequently, searching for words that used to come easily. As the condition progresses, these difficulties become more pronounced. Following conversations, especially in a group setting, can become increasingly challenging. Understanding complex sentences or instructions might require more effort. If you notice these changes in yourself or someone you know, don't hesitate to seek professional help. Speech therapy and other interventions can provide valuable strategies for managing communication difficulties and maintaining social connections. Our brains are incredible at spatial awareness, helping us navigate our world with remarkable ease. We develop mental maps of familiar places, effortlessly recalling routes and landmarks. But dementia can disrupt this intricate system, leading to disorientation to time and place. Imagine walking down your own street, a path you've taken countless times, and suddenly feeling unsure of where you are or how to get home. This sense of disorientation can be deeply unsettling, even frightening. In the early stages of dementia, this disorientation might manifest as forgetting directions, getting lost in familiar places, or misplacing everyday objects. Individuals might struggle to keep track of appointments, or lose track of the date or time of day. As the condition progresses, the disorientation can become more severe. They may have difficulty recognizing familiar faces or places, even their own homes. If you notice these signs in yourself or someone you know, it's essential to consult a medical professional. Early diagnosis and treatment can help manage symptoms and ensure the individual's safety and well-being. Good judgment is essential for navigating the complexities of life. We make decisions every day, some small, some life-altering, relying on our ability to weigh options, assess risks, and make sound choices. But dementia can erode this critical faculty, impacting decision-making skills in significant ways. In the early stages, these changes might be subtle. You might notice someone making uncharacteristic financial decisions, neglecting their personal hygiene, or exhibiting poor judgment in social situations. They might fall victim to scams or make impulsive purchases that are out of character. As dementia progresses, decision-making abilities can deteriorate further. Individuals might struggle to make simple choices, like what to wear or what to eat. If you observe these signs in yourself or someone you know, seek guidance from a healthcare professional. Early intervention can help manage symptoms, protect the individual's well-being, and provide support for families navigating these challenging changes. We've all been there. Misplacing our keys, our phone, that important document we just had in our hands. It's a common human experience, often accompanied by a frantic search and a sigh of relief when the lost item is found. But for individuals in the early stages of dementia, misplacing things takes on a different dimension. It's not just about forgetting where you left something, it's about putting objects in illogical places and having no recollection of how they got there. The TV remote in the refrigerator, a wallet in the sugar bowl, car keys in the bathroom sink. These unusual hiding spots can be baffling and frustrating for both the individual and their loved ones. The reason behind this behavior lies in the way dementia affects the brain's ability to form new memories and recall information. As the disease progresses, the brain struggles to keep track of where things are placed, leading to these unusual storage choices. If you notice this pattern of misplacing things in unusual places, it's essential to talk to a doctor. Early diagnosis can help manage symptoms and provide strategies for coping with the challenges of memory loss. We've covered a lot of ground today, discussing the subtle and often overlooked early signs of dementia. But now, let's address a symptom that tends to emerge in the later stages of the disease. Bedwetting, also known as nocturnal enuresis. While bedwetting is often associated with childhood, it can reappear in adulthood as a result of various medical conditions, including dementia. As dementia progresses, it can affect the brain's ability to control bladder function, leading to involuntary urination during sleep. It's important to understand that bedwetting in the context of dementia is not a sign of regression or a lack of willpower. It's a physical symptom caused by the disease's impact on the nervous system. Individuals experiencing this symptom are not doing it intentionally and often feel embarrassed and ashamed. If you're caring for someone with dementia who experiences bedwetting, it's crucial to approach the situation with sensitivity and compassion. Consult a healthcare professional to rule out other potential causes of bedwetting and discuss strategies for managing the symptom. Remember, even in the later stages of dementia, there are ways to maintain dignity and improve quality of life for both the individual and their caregivers. Thank you for watching. If you found this video helpful, please like, share, and subscribe to our channel for more informative content. Remember, early detection is key, so stay informed and take care. From subtle memory lapses to difficulties with familiar tasks, these signs can easily go unnoticed or be dismissed as normal aging. But recognizing them early can make a world of difference.